Today we will study about breastfeeding. In this chapter you will study about introduction, breast milk description, breastfeeding importance, breastfeeding techniques, breastfeeding time, squeezing of breast milk. Introduction. Breastfeeding is the process of feeding an infant breast milk either directly from the breast or expressed and given from a bottle. It's a vital way to ensure child health and survival, providing essential nutrients and antibodies for the baby's growth and protection against illness. Breast milk description. Breast milk is the ideal food for the infant, providing a complete nutritional package to their needs during the first 6 months of life. It contains a mix of essential nutrients, bioactive factors, and antibiotics that support growth, development, and immune protection. Stages of breast milk. Colostrum, the first milk producer rich in antibodies and concentrated nutrients, is vital for the newborn's initial health. Transitional milk. Following colostrum, transitional milk appears increasing in quantity and containing higher levels of fat, calories, lactose, and vitamins. Mature milk, this milk produced after about 10 to 15 days, is primarily water with increased fat content as the feeding progresses, with foremilk thinner, lower fat, and hind milk richer, higher fat. Breast milk changes during a feed session. Foremilk is a milk produced at the beginning of a feeding, appearing thinner and bluish gray due to the lower fat content. Hand milk produced towards the end, it is thicker and creamy with a higher fat content. Both are essential for the baby's nutrition and development. For milk, appearance thin and watery, often bluish gray in color. Composition higher in lactose, carbohydrates, and water, lower in fat. Purpose quenches thirst, provides hydration, and stimulates the digestive system. Benefits contains essential nutrients, vitamins, and antibodies. Hand milk appearance thick and creamy, white in color. Composition rich in fat, proteins, and other essential nutrients. Purpose satisfies hunger, promotes weight gain, and provides sustained energy. Benefits supports growth, development, and provides a feeling of fullness. Important consideration, not separate milks. Foremilk and hand milk are not distinct types of milk but rather different in stages of milk. Same milk produced during a feed. Balance is key. Both foremilk and hand milk are crucial for the baby's overall health and development. Avoid imbalance. Ensure that the baby feeds efficiently and empties one breast before switching to the other, helps them receive a balanced intake of both foremilk and hind milk. Importance of breastfeeding. Benefits for infant. Optimal nutrition. Breast milk is a complete food source providing all the necessary nutrients for a baby growth and development during the first 6 months of life. It also continues to provide vital nutrients and immune boosting components for up to 2 years or beyond. Enhance immunity. Breast milk contain antibodies and other immune factors that protects infant from various infections including diarrhea, respiratory illness and ear infections. Reduce risk of chronic disease. Breastfeed babies have a lower risk of developing chronic conditions like obesity, type 1 and type 2 diabetics and certain cancers later in life. Improve cognitive development. Studies suggest that a breastfed infant may perform better on intelligence tests and have a lower risk of learning disabilities. Better digestive health. Breast milk is easily digested and absorbed by infant, reducing the risk of digestive issues. Benefits for the mother. Fa- Fasten postpartum recovery. Breastfeeding helps the uterus contract back to its normal size and can reduce postpartum bleeding. Reduce the cancer risk. Study shows that breastfeeding can lower a mother's risk for developing breast and ovarian cancer. Low risk for other diseases. Breastfeeding may also reduce the risk of type 2 diabetics, osteoporosis, and cardiovascular diseases. Emotional bonding. The close physical contact and interaction during breastfeeding promotes a strong emotional bond between mother and the baby. Convenient and cost saving. Breastfeeding eliminates that need for a formula preparation and is cost effective way to feed the baby. Breastfeeding techniques. Breastfeeding techniques involves proper positioning and latching to ensure a comfortable and effective feeding experience for both mother and the baby. Key techniques include ensuring the baby is tummy to tummy with the mother, supporting the baby's head and body, and guiding the baby to latch onto the alveoli, not just the nipple. Nursing, especially in the first hour after birth, and avoiding bottle pacifiers and formula initially can help establish a good breastfeeding routine. Positioning. Tummy to tummy. The baby's body should be aligned with the mother, allowing for easy assist to the breast. Head and neck alignment. The baby's head and body should be in a straight line without twisting, ensuring easy swallowing and breathing. Support. Support the baby's head, neck, and back while allowing them to move their head freely to find the nipple. Chin to breast. The baby's chin should be touching the breast and the nose should be clear for easy breathing. Nipple position. Position the nipple near the baby's nose, which will encourage them to open their mouth wide. Latching. Wide open mouth. Wait for the baby to open their mouth wide like a yawn before bringing them to the breast. Areola latch. The baby should latch onto the areola, not just the nipple, with more on the areola visible above the baby's top lip than below. Deep latch. Ensure that the baby is latching deeply with the nipple far back in their mouth to prevent nipple sore and ensure effective milk transfer. Signs of a good latch. Listen for rhythmic sucking and swallowing and observe the baby's cheeks for fullness. Comfort. If latching is painful, reposition the baby and try again. This is a bad latching technique. Shallow latch, painful and effective. This is a good latching technique. Deep latch, that is painless and effective. Other tips. Frequent nursing. Nurse frequently, especially in the first few weeks, to establish a good milk supply and help the baby get used to breastfeed. Rooming. Keep the baby in the same room as the mother to allow for frequent nursing. Avoid artificial nipples. Avoid bottle pacifier and a formula initially to avoid the baby to get used to breastfeeding. Breastfeeding position. Cradle position, side lying position, football position, reclined or ladder back position. Breastfeeding time. Breastfeeding duration varies, but newborns typically feed for 20 to 45 minutes per session, while older babies may take 10 to 20 minutes. Frequency is also important, with a newborns feeding 8 to 12 times per day, often every 1 to 3 hours. Factors like a baby's age, maturity, and the mother's milk supply can influence how long a breastfeeding session takes. Newborns. In the first few days, newborns may nourish frequently every 1.5 to 3 hours for at least 20 to 45 minutes per session. As they grow, they may become more efficient and requires less time at the breast. Older babies. Babies 6 months and older may nourish for 10 to 20 minutes per session. Frequency. Newborns typically feed 8 to 12 times in a 24-hour period. This can be even 1 to 3 hours or more often, especially in the early days. influencing duration, baby's age and maturity. Premature babies may take longer to feed than full term babies. Mother's milk supply. Low milk supply can lead to longer feeding sessions. Baby's latch. An improper latch can affect how effectively the baby nourishes. Cleanliness. Drowsy babies may need more time to latch and empty the breast. Distraction. Distracted babies may need more frequent, shorter feeds. Watch for a quiz like turning the head, opening their mouth, and rooting, moving their head towards the breast. Expressing breast milk or squeezing of breast milk. Expressing breast milk, also known as hand expressing or a manual expression, involving squeezing milk from your breast to collect it for later feeding. It's a technique used when a baby can't directly breastfeed or when a mother wants to boost or maintain her breast milk supply. Preparation. Hygiene. Wash your hand thoroughly with soap and warm water. Warmth and massage. Gently massage your breast to encourage milk flow. You can also try warm compression or a warm shower. Positioning. Cup your breast with your hand using your thumb and finger about 2 to 3 centimeters behind the nipple. Stimulation. Think about your baby or look at a picture to stimulate the let down reflex. Technique. Press and compress. Gently press your fingers and thumb towards your chest while compressing the milk ducts. Release and repeat. Release the pressure and repeat the squeezing motion in a rhythmic pattern. Avoid sliding. Do not slide your fingers over the skin as they can cause soreness. Rotate and repeat. When the milk flow slows, rotate your finger to a different area of the areola and repeat the process. Switching breast. After one breast emptied, switch to the other and repeat the process. Key points. Practice. It may take some time and practice the master the technique. Gentle press. Use gentle and a constant pressure, not forceful squeezing. Listen to your body. If you feel pain, adjust your technique or seek guidance from a healthcare professional. Colostrum. In the first few days, so you may only express small amount of colostrum, which is normal. Storage. Once expressed breast milk can be stored in a sterilized container for later use. When to hand press. Engorgement to relieve uncomfortable fullness, inadequate latching when a baby has a difficulty latching or sucking, boost milk supply to increase milk production, separation from the baby when you need to be away from your baby, supporting partner feeding if you want your partner to help with the feeding.